Hello, I'm Dr. Marianne Teitelbaum, and today we're going to talk about fatty liver disease. Now, there's two main forms of fatty liver disease. The first one is alcoholic liver disease, and this results from heavy drinking and causes accumulation of fat in the liver. Moderate drinking is defined as 1 drink a day for women and up to 2 drinks a day for men. About 5% of people in the United States have this form of liver disease. But the second is called non-alcoholic fatty liver disease, and it occurs in people who aren't heavy drinkers or who may not even drink at all. And this condition affects 1 in 3 adults. That's a lot. 1 in 3 adults and 1 in 10 children in the United States. So many of the patients I see have this form of fatty liver, and many of them are vegetarian. They eat freshly made homemade food at home, and they never drink alcohol or eat junk food. So how could this be? Something's obviously scarring their liver. We'll talk about it in just a minute. High levels of liver enzymes which turn up on blood work are a sign that your liver is injured. And to definitively diagnose a fatty liver, your doctor might order an ultrasound or a CT scan of the liver or a liver biopsy to determine how far the liver disease has progressed. In most cases, the fatty liver disease doesn't cause any serious problems or prevent your liver from functioning properly. But for 7 to 30% of people with the condition, the fatty liver disease gets worse over time, and it can progress through 3 stages. In the first stage, the liver becomes inflamed and swollen, which damages its tissue. In the second stage, scar tissue forms where your liver is damaged. This process is called fibrosis. And by the third stage, extensive scar tissue replaces the healthy tissue, causing cirrhosis of the liver. And this hard scar tissue that replaces healthy liver tissue slows down the liver's function. It can actually block the liver functions entirely. So cirrhosis can lead to liver failure and liver cancer. So you want to catch the fatty liver disease in the early stages and reverse it. Obesity, metabolic syndrome, and type 2 diabetes increase the risk of developing fatty liver disease, but by far, the most common cause is the consumption of vegetable oils containing omega-6 fatty acids. This is what I see every day in my busy Ayurvedic practice. Early on, I used to wonder how this could be. I had hundreds of patients present with fatty liver, yet when I asked them if they had ever drank alcohol, the reply was always no, never. Then when I asked them what they ate, it was usually a very healthy diet. They were cooking homemade food from scratch every day, with no processed foods. And I remember in those early years trying to figure out what had tortured their liver. Many of the Americans were taking lots of synthetic nutraceuticals and pharmaceuticals, processed foods. So I attributed their fatty liver to years of neglect, because the liver has to process all these harsh foods and chemicals. But the people I saw from India weren't taking vitamins, and they never took the high doses of birth control pills, antibiotics, and other medications that the Americans take, which do disrupt their liver function over time. So it was an enigma. I used to actually lie in bed at night wondering how hundreds and thousands of my Indian patients had fatty liver when there was no obvious reason for their liver damage. Then it finally occurred to me. I realized I had never asked them what type of cooking oils they were using. And when I did, it became obvious how the damage had occurred. They were all using processed vegetable oils. They all reported to me that they consumed mustard oil, groundnut oil, which is peanut oil, canola, and other vegetable oil blends on a regular basis. It turns out that when you heat these oils, compounds are formed, which cause severe liver damage in a very short period of time, even by the time a person is a teenager. Let's take a look more deeply at this very important issue, because this very same thing is happening to people all around the world. And it causes not only a fatty liver, but plaque buildup in the arteries, as these oils also form a plastic which clogs the arteries once they're heated. Now, the term vegetable oil is used to refer to any oil that comes from plant sources. So the vegetable oils would include, but aren't limited to, the following: corn oil, soybean oil, canola, sunflower, peanut oil, cottonseed oil, palm, mustard, and safflower oils. These oils are referred to as industrial oils because they require the use of chemical solvents, such as hexane, to extract the oil from the seed. The oils are then hydrogenated at high temperatures and then deodorized. Processed oils have been pushed way past their heat tolerance and have become rancid during their processing. These oils are rich in omega-6 polyunsaturated acids. And so while we may need a small amount of omega-6s in our diet, the best range of omega-6 to omega-3 ratio is 2:1, or even better, 1:1. But the modern diet has dramatically shifted this ratio up to 15:1 and even up to 50:1. Now, when you heat these dangerous oils, they form a poison. And since everything you swallow has to be processed by the liver, they end up damaging it over time, causing this huge epidemic of fatty liver disease we're seeing in most of the industrialized world. Also, as a side note, just avoid flaxseed oil. It contains too much inherent heat, which is especially harsh to both the liver and the spleen. So you must carefully choose the type of oil you use for cooking. Yes, it may be much more expensive than the cheap industrial oils, but your health is worth it. Here are some other reasons for a fatty liver, but again, by far, from what I can see in my patients, the use of the cheap vegetable oils accounts for a large percentage of the fatty liver disease. So first, avoid white refined table sugar and agave, because both are poisonous to the liver. Too much refined sugar and fructose corn syrup causes a fatty buildup in the liver, and in fact some studies show that these types of sugar can be as damaging to the liver as alcohol. Instead, use other forms of sugar like jaggery, coconut sugar, maple syrup, sucanat, evaporated cane juice, and raw honey. These are more natural types of sugar that won't damage the liver. Now, some people take kava kava. It's an herb for symptoms of menopause or to help them relax. But studies show that it can keep the liver from functioning properly, and it could lead to hepatitis and liver failure. Some countries have restricted its use or banned it altogether, but it's still available in the United States, so be very careful if you use that herb. Avoid high doses of vitamin A supplements because they can disturb the liver function as well. It's best to get this vitamin through fresh fruits and vegetables, especially those that are red, orange, and yellow in color. Nature always puts these vitamins in the food in small amounts for good reason. Just because a little is good for you doesn't mean lots is better. Now, acetaminophen, which is used for pain, headaches, cold symptoms, and insomnia, can also cause a lot of liver damage if it's taken at too high a dose or for too long. In fact, I once had a patient who took the recommended dose of acetaminophen every night for years to help her sleep, but even at the normal dose, it damaged her liver to the point where she needed a liver transplant. Please be careful of your intake of alcohol because it can definitely cause a fatty liver, even if you're not an alcoholic or addicted to alcohol, because it's extremely damaging to the liver. Now, no medicines have been approved to treat fatty liver disease because by nature, all pharmaceuticals are toxic to the liver. But this is where Ayurveda comes in. We have numerous treatments to quickly and effectively reverse fatty liver disease, including diet, daily routine, cleansing techniques, and many herbs to heal the liver. First and foremost, include organic extra virgin, cold-pressed, pure olive oil in your diet. But keep in mind that most of the olive oil found in your local supermarkets are processed with heat and chemicals. They have lots of vegetable oils blended into them, making them just as dangerous as the plain vegetable oils we just talked about. Many people think they're eating a heart-healthy oil when they buy these cheap olive oils on the market. Search out the pure, more expensive, cold-pressed, extra virgin olive oils loaded with polyphenols to keep your liver as healthy as you can. And the ancient doctors of India said that ghee was easier to digest than any oil. Make sure the ghee you get is from grass-fed cows, because they make lots of omega-3s when they eat grass. Most of the cows in the United States are fed grains, so their milk and butter will contain very high levels of omega-6s as a result, which again will cause lots of fatty liver disease. And it could cause cancer and diabetes as well. So if you make ghee, make sure the butter you're using is from grass-fed cows. Keep your liver happy by consuming only olive oil and ghee. See, olive oil, avocado oil, and coconut oil, they're all considered the fruit oils. And while it's true that they're not classified as vegetable oils, and they're therefore more healthy, we still don't recommend the widespread use of avocado and coconut oils because they're very heavy, cold, and difficult to digest. Just stick with the olive oil to be on the safe side. Bitter melon, also known as bitter gourd or Karela, is very good for healing the liver. Its bitter taste helps to pull toxins from the liver. Now, the liver actually heats up when it's holding on to a lot of toxins. So we teach our patients how to cook with Loki squash, which is the most cooling food for the liver. Yellow squash and green zucchini are a good second choice too. We also use various liver clay packs and transdermal creams made with deglycerized licorice to apply directly onto the liver to cool it down. Cooked beets, artichokes, moringa leaves, and the drumstick from the moringa tree are also excellent for detoxifying the liver. Now, turmeric is considered the best friend to the liver as it helps it to detoxify, but it quickly becomes its enemy if you take capsules of it, or even worse, curcumin, which is the active ingredient in the turmeric. Both will overly heat the liver and upset its function. Just cook with turmeric in the diet. It's easiest to assimilate if you cook it into a fat, like either boiled whole milk or sauteed in ghee or olive oil. And don't cook with the fresh root of the turmeric because it too is heating to the liver. And be careful of the turmeric sold in some Indian markets because it could be a white powder with a yellow dye sprayed onto it. Ayurveda has lots of herbs for the liver which can both clean it and cool it down. And this is an important issue because there are many herbs found in both Ayurveda and other systems of healing which clean the liver, but most heat the liver as they do this, especially milk thistle, which, while it may have lots of benefit to the liver, it also heats it up tremendously in the process of healing it, which can backfire on you in this modern age when the liver is so hot and distressed by many of the thousands of chemicals that we've allowed into our environment, all of which are heating. So we must pull from our vast array of cleansing liver herbs only those which keep the liver cool as they clean it. And the best news of all is that we actually have herbs which can regenerate liver cells once they've been damaged. That's the good news about the liver. It's quite good at regenerating itself. You just have to know how to do it. Which is why we have an excellent track record of treating fatty liver disease, especially if it's detected in its early stages, before it has progressed to severe cirrhosis of the liver. Please learn how to take good care of the liver, as the ancient Ayurvedic doctors considered it the most important organ in the body because it has over 500 functions, the most important of which is that it keeps the blood clean for optimum brain function. And as I just mentioned, the liver is very good at rejuvenating itself, unlike some of the other organs in the body. And you can usually reverse a fatty liver if you put into action many of the methods I have just mentioned here. By following these guidelines, you can have an extremely healthy life if you keep your liver in good shape, because almost every disease process you can think of begins with weak liver function. Thank you.